Here is a great case of solid filler smooth PDO threads. Using the stepladder technique, this is an AAFE exclusive technique to go ahead and rejuvenate the skin, get rid of some unwanted chin and neck fat permanently. That's what's going to happen here, and really tighten this area on an older patient. And this is a repeatable treatment. This is her third treatment here, and we have seen incredible results here with this treatment here. And so what we are doing is we are using a thin polydeoxanone suture thread that is in a 29 gauge by 30 millimeter needle, and you've got to be in the right plane. This is all about getting properly certification training by the AAFE. Once you're in the right plane and you know the anatomy, you better know the anatomy here, right? I mean, this the neck anatomy can be really crucial because there are a lot of different things running up in that neck. So you've got to be in the right plane, not too shallow because you won't get an effect, not too deep because of the anatomy here. But once you know the right plane, they go in really easy. And you can see how we marked off that stepladder area here, so we know exactly where to put them. It's going to be in and between all of the necklace lines. We're looking to lighten the necklace lines, but the overall treatment is skin tightening and collagen production. Older patient like this, you can see the skin texture, which is much improved, being that she's already had a couple of sessions of the solid filler smooth PDO threads. And when we first started, it was much more crepey, much more wrinkled. So this is really incredible results so far, and it's only going to get better and better. We're going to leave behind the thread after we turn these things 360, and then over the course of the next few weeks, the thread is going to break down, at which time the body's natural reaction is to produce great collagen here, and that is going to be so fantastic, and elastin as well. So it's going to rejuvenate that skin, give us revascularization, neocollagenesis, and that's why that skin is going to go from crepey, which at this point it's not even crepey anymore, but it goes from crepey to nice and smooth and really get tightened up. And I want to show you this case specifically because it is a more difficult case. And now we're going after some of the other areas that still have a little bit of crepiness and just needs a few more threads to go ahead and place this. It's an easy procedure once you're well trained. And if you already do Botox and dermal fillers, or you're thinking about getting into it, you must add PDO threads, especially smooth PDO threads. It's a different kind of a filler, but it's the kind of filler that grows collagen as opposed to the other fillers which just replace volume and then start to go away at the 6-month mark. This collagen will stay for a couple of years. So it's time for you to think about getting AAFE certification trained on Botox, on fillers, and on smooth PDO threads. You've got to add this to your practice now. Get AAFE certification trained today. And I've got to go ahead and show you her before and after, because look at that. That is after 3 treatments. That is amazing. Is it perfect? No. But for this patient, she is absolutely thrilled. The crepiness is gone. So is some of the fat. Look how tight that is compared to where we started. This is an amazing treatment, what you can do with solid filler smooth PDO threads. You've got to get AAFE certification trained today, and you can get results just like this.